The recently published Graham report talks about antimicrobial resistance (AMR), where antibiotics become ineffective because pathogens become resistant to them. According to the report, as many as 4.95 million deaths have been associated with bacterial antimicrobial resistance in 2019 in South Asia. Over 3,89,000 people died as a direct result of antimicrobial resistance. One pathogen drug combination, methicillin-resistant Staphylococcus aureus, caused more than 1 lakh deaths attributable to antimicrobial resistance. Our use of antimicrobial treatment should be more thoughtful, wherein life-saving antibiotics are given where needed and minimalized when they are not necessary. Antimicrobial resistance or antibiotics becoming ineffective because pathogens such as virus, fungi, and bacteria become resistant to them has long been recognized as a major threat to public health. However, there are only few estimates on the scale of problem and the regional variations. Based on the estimates from 204 countries and territories, the Global Research on Antimicrobial Resistance that is GRAM, published in the Lancet on Thursday provides most comprehensive estimate of global impact of antimicrobial resistance so far. What did the GRAM report find? The finding is that as many as 4.95 million deaths have been associated with bacterial antimicrobial resistance in 2019. Estimates included in the paper show that AMR is a leading cause of death globally, higher than HIV, AIDS or malaria. In South Asia, over 3,89,000 people died as a direct result of AMR in 2019. The death rate was higher in Western Sub-Saharan Africa, 27.3 deaths per 1 lakh, and lowest in Australia, that is 6.5 deaths per 1 lakh. Lower respiratory tract infection accounted for more than 1.5 million deaths associated with resistance in 2019, making it the most common infectious syndrome. The 6 leading pathogens for the deaths associated with resistance were Escherichia coli, followed by Staphylococcus aureus, followed by Klebsiella pneumoniae, Streptococcus pneumoniae, Acinetobacter baumannii, and Pseudomonas aeruginosa. They were responsible for 3.57 million deaths associated with AMR in 2019. One pathogen drug combination, methicillin-resistant Staphylococcus aureus, caused more than 1 lakh deaths attributable to AMR in 2019, while 6 more each caused 50,000 to 1 lakh deaths. How was this GRAM study done? GRAM is led out by University of Oxford Big Data Institute, IHME Strategic Partnership. IHME is the Institute for Health Metrics. The research paper lists a large number of contributors from across the world who provide data from multiple sources including microbiology data, inpatient data, data on multiple causes of death, and pharmaceutical sales data. The data was then broken down by region into deaths in which infection played a role by infectious syndrome, pathogen distribution for death and incident cases, incidence of infectious syndromes disaggregated by age, sex, and location, prevalence of resistance by pathogen, relative risk of death for drug-resistant infection compared with drug-sensitive infection, and finally computing the burden attributable to drug resistance and burden associated with drug-resistant infections. What are the implications of this study? Common infections such as lower respiratory tract infection, bloodstream infection, and intra-abdominal infection are now killing hundreds of thousands of people every year because bacteria have become resistant to treatment. These include historically treatable illnesses such as pneumonia, hospital-acquired infections, and foodborne ailments. Everyone is at risk from AMR, but the data shows that young children are particularly affected. In 2019, 1 in 5 global deaths attributable to AMR occurred in children under the age of 5, often from previously treatable infection. AMR is threatening the ability of hospitals to keep patients safe from infection and undermining the ability of doctors to carry out essential medical practice safely, including surgery, childbirth, and cancer treatment. Since infection is a risk following these procedures, between 1980 and 2000, 63 new antibiotics were approved for clinical use. Between 2000 and 2018, just 15 additional antibiotics were approved. Out of the 7 deadliest drug-resistant bacteria, vaccines are only available for 2, that is Streptococcus pneumoniae and Mycobacterium tuberculosis. While all the 7 leading bacteria have been identified as priority pathogen by WHO, only 2 have been a focus of major global health intervention program. S. pneumoniae primarily through pneumococcal vaccination and Mycobacterium tuberculosis. What we can do about this? They have recommended greater action to monitor and control the infection globally, nationally, and within individual hospitals. Access to vaccines, clean water and sanitation ought to be expanded. The use of antibiotics unrelated to treating human disease, such as in food and animal production, must be optimized. And finally, they recommend being more thoughtful about our use of antimicrobial treatment, expanding access to life-saving antibiotics where needed, minimizing use where they are not necessary to improve human health, and acting according to WHO recommendation on the same. They also recommend increased funding for developing new antimicrobials and targeting priority pathogens such as Klebsiella pneumoniae and E. coli, and ensuring that they are affordable and accessible to the most of the world.